If you're confused about drug plans, there's no need to be. Back on January 1st of 2025, Medicare, CMS, changed the way that you pay for medications. Years before, there used to be something called the donut hole or the gap, and people would fall into the donut hole and their prices would skyrocket. Since January 1st of 2025, you now are capped at a certain limit every year that you have to pay out of your pocket called copayments or deductibles. Those are combined to tally at least $2,000. Now in 2025, that limit was $2,000 and it goes up every single year. So please check this year's limit. And how this works is if you pay anything at the supermarket, the prescription store, the pharmacy, you're going to have a copayment on a lot of different medications. You'll first pay off a deductible, and that deductible goes up every single year. That deductible is determined by the government, not by the insurance carriers. Although the insurance carriers can decide to lower it, they just can't go over the deductible limit set by the government. So you go about your business, you buy a drug plan called Part D, you pay a monthly premium, and then when you fulfill your medications, you possibly could pay some co-payments and deductibles. Once $2,000, at least for 2025, once the $2,000 comes out of your pocket, you are no longer responsible for the cost of your medications. The drug plan company is pretty much on the hook for most of it, upwards of 75% of it. And so for the rest of the year, calendar year, you have absolutely zero costs for co-payments or deductibles, but you still are obligated to pay your monthly premium. So there are limits to how much you actually are asked to spend on a yearly basis. Check the numbers because the deductibles change every year and the limit, the amount that you're expected to share in, goes up every year as well. Find a good broker that understands this stuff. They will look up the plans for you and tell you which plan would be most advantageous for this particular year.